let's start our topic for today. That is the first topic in obstetrics, and we have to know certain important terms because this is a new subject for you. So many terms are new here. Okay, so this is the important class. And after this, probably in the second half of the class, if I finish this in time, then I'll start how to take history and how to do physical examination in obstetrics. Then from second or third classes onward, we'll enter into the proper obstetrics. Now see here. So first of all, we should know what is obstetrics. Just like any other branches of clinical medicine, like internal medicine, like surgery, like gynecology, like ophthalmology, like ENT, this is also a branch of medicine which specializes in the care of women during pregnancy and childbirth. So this is a special branch of the medicine which deals with pregnant ladies and what happens to them during childbirth. Okay, so this is called obstetrics. And many of the time obstetrics term is combined with gynecology. So the same surgeon which specializes in gynecology is a specialist in obstetrics also. Okay, so we call them obstetrician and gynecologist. In short form, we call it OBG, obstetrics and gynecology. So in your country, especially, I'm talking about Pakistan. I have students from other countries also, but overwhelming majorities are from Pakistan. That's why I'm taking the example. Okay, I know male, doctors, they do not, eager to join obstetrics, but that is not the reason for us to not study this well. Okay, there are lots of female students. I'm sure my female students, they want to join obstetrics later on. They want to make career in obstetrics, and this is an absolutely important field. Okay, so even according to the importance, this is not as important as internal medicine or general surgery or pediatrics. Okay, for MBBS level, that's what I'm talking about now. After you do your MBBS or after you finish it, you can easily go for post graduation in obstetrics and gynecology. Okay, you will have a very good career there. So obstetrics means it is a branch of medicine which specializes in the care of women during pregnancy and childbirth. Now let's move on. There are so many important terms here. The first of them are gravida and para, or you can call it gravidity and parity. What do you mean by them? Now, gravida means the total number of pregnancies. I'll make it very, very simple for you. Gravidity means if a lady becomes pregnant, she is gravida 1. Okay, if there are 3 times she become pregnant, gravida is 3. So gravida is the total number of pregnancy. It doesn't consider gestational age. Any gestational age is considered as a gravida. So if she is pregnant, for example, if urine HCG test is positive, she is gravida 1. Okay, for example, she has one child at home and she is again pregnant, that is gravida 2 now, because she was already pregnant before and this is the second time. Now see there. So gravida includes abortion, because abortion is also a type of pregnancy, isn't it? Ectopic pregnancy, if the implantation doesn't occur in the uterine cavity, but if implantation occur in the fallopian tube or outside the uterine cavity anywhere, this is called ectopic pregnancy. This is considered a very a serious condition. Okay, we have a big class later on regarding ectopic pregnancy. Another is hydatidiform mole. Probably in pathology, okay, you have heard about hydatidiform mole. This hydatidiform mole is also known as molar pregnancy. This is the abnormal type of pregnancy. So whatever normal or abnormal, if the lady is pregnant, she is considered as a gravid one. But one important point is, sometimes the lady gives birth to twins, sometimes triplet, means 3 babies, sometimes even quadruplet, sometimes even more than that. The cases have been reported. But one important point is, every type of multiple pregnancy, we call them twin, triplet, quadruplet, we call them multiple pregnancy, they are also considered as gravida 1. They are also considered as gravida 1. Okay, so we will have some example later on. Okay, then it will be very, very clear. Now, what is parity then? Now, parity means the total number of pregnancy that have been carried to more than 20 weeks. Now, you may be wondering why 20 weeks is taken, okay, as a borderline there. Because this 20 weeks is called period of viability. Now, viability means we believe after this 20 week, the baby, if the baby is delivered, that baby can survive. But before 20 week, it is considered very, very difficult. That's why this 20 week is considered as a period of viability. Please remember this. Now, if you consult some of the older textbook of obstetrics, then this period is probably mentioned as 24 week or even 28 week, because at that time the period of viability was considered 24 or 28 week. But now, because of the advances in obstetrics or advances in medicine, I should say, the period of viability is decreasing, and that is good thing for us, because even if the baby is delivered at 20 weeks, there is a high chance that that baby can survive. So this is the meaning. So what is parity? The total number of pregnancy which have carried to more than 20 weeks is called parity. Now, let me clarify this once again. This is very important concept. Twins are always counted as one parity. Though there are 2 babies, parity is still 1. Triplet also, parity is 1. Quadruplet also, parity is 1. That's the first point. And second, if there is abortion, now abortion means the pregnancy is discontinued before 20 week. It has not crossed 20 week. So abortion is not considered a part of parity. So if a lady has aborted, or if she has abortion in the past, means parity is still 0. Okay, so this is important point. So it has to cross 20 weeks, and abortion is not a part of a parity. Now, another important point that should come in your mind. Sometimes what happens, the baby is born dead, isn't it? The baby is born dead. The baby is more than 20 weeks, but is born dead. This is called stillbirth. I'll talk about it a bit later, but stillbirth is considered parity because it has crossed 20 weeks. So we don't need only the living babies to consider parity, even if the baby is dead, but if the baby has crossed 20 weeks, it is parity. So this is very important point. And sometimes if the lady has given birth, okay, to 4 or more babies, and all of them are more than 20 weeks gestation, then it is called grand multiparity. Now look at here very carefully. There are so many important points. A full-term baby means the baby which has crossed more than 37 completed weeks of gestation. Okay. Now one simple question to you, probably many students already know. What is the total duration of pregnancy? Anyone?
38 weeks. 38 weeks to 80 days.
Okay, good. I can consider that answer as a correct one. But remember, this is a very, very easy answer. You just say 40 weeks. Okay, a pregnancy, the average duration of a normal pregnancy is 40 weeks. So if you convert that 40 week into days, just multiply by 7, it would be 280 days. Okay, 280 days. But easy one is you say 40 weeks. Now there is a range there. I'm talking about the average one. Okay, So whenever I talk about average one, there is always a range, and that range is 37 to 42. Okay, so let me show it, show here for you. See here. Okay, see this, 37 to 42 weeks is considered as a term pregnancy. So less than 37 week is called premature or preterm pregnancy. So less than 37 week is a premature or preterm. Full term or term more than 37 up to 42, and if the pregnancy crosses more than 42 weeks, then it is called post-term pregnancy. Now, one important point here, both preterm and post-term pregnancies are not considered a normal one. There's lots of complication which you can expect in both of them, preterm as well as post-term. Okay, these are the special classes on itself or themselves, so we have to deal this later on. Today we will mainly focus on definition. So once again, term 37 to 42 week, preterm before 37 weeks, post-term more than 42 week. Now please remember here, premature or preterm starts from 20 to 37 week, because if it is before 20, it is called abortion. Okay, so we do not consider that as a part of this normal definition which we are talking. Abortion has a altogether a very new or a different type of definition. Now see this, it is written very clearly here. Abortion, if pregnancy is discontinued, okay, before 20 week, or if it lasts less than 20 week, it is called abortion. Now abortion can be of two types. One is called spontaneous abortion and another is called induced abortion. Spontaneous and induced. Now spontaneous means on its own. Okay, there is no justifiable cause for that. We need to find out the cause, but we have not used any medicine or things like that. Okay, it has occurred by itself. This is spontaneous abortion. And induced means sometimes what happens, the process has already started. Okay, the lady, let me give you an example here. The lady is pregnant for 3 months. 3 months means remember around 12 weeks. She has already started to bleed, and we believe we cannot prevent or protect or continue this pregnancy. Now what is the option we have? We have to discontinue it with the help of some medicine or some procedure. This is called induced abortion. Okay, this is a special class, so later on we have a big discussion about abortion. Now see there, another important one is our pregnancy is divided into 3 trimesters. Okay, and those 3 trimesters are written there. Okay, please see there. So what are those 3 trimesters? First trimester, second trimester, and third trimester. So first trimester is from the beginning till the end of 12 weeks is first trimester. Second starts from 13 to 27 week, and the third from 28 till the end, that is 40 week. So these are 3 trimesters of the pregnancy, and each trimester has its own importance. Okay, the first trimester, the organogenesis is going on in first trimester. You have already studied this in embryology. Okay, embryology was already taught to you. So first trimester organogenesis occur. In second trimester, the development of those organs occur, and the third trimester, the size of the baby rapidly improve in third trimester, and a lot of things from the mother are transferred to the baby during third trimester. Now see here, what is abortion? Abortion means, now every student know it already, if a loss of intrauterine pregnancy occur before the period of viability, that is before 20 weeks of gestation, it is called abortion. Abortion is also known as miscarriages. Okay, this is a very common term, miscarriages or abortion. Now, if usually if we take the weight of that baby, it is less than 500 gram, but it is not an important part of definition. You just remember the duration, less than 20 weeks. If the pregnancy is discontinued, okay, if there is a loss of pregnancy, then it is called abortion. Now, abortion can be induced and spontaneous. Okay, I already talked about it. Induced is done by the doctors with the help of medicine or with the help of some procedure, okay, like some surgical procedure or some instrumentation. And spontaneous means it occurs on its own. Now, what is stillbirth then? Stillbirth means the duration of pregnancy is more than 20 weeks. Okay, it has crossed more than 20 weeks, but okay, it doesn't give rise to live birth. Means the baby is dead now. Now, I want to give different example to you. Now, one lady has come to our hospital with 30 weeks of gestation. 30 weeks. It is definitely more than 20. But okay, when she delivered the baby is dead. So this is called stillbirth. Very easy meaning. Stillbirth rate is the annual number of stillbirth per 1000 total birth. Annual means per year in 12 months. Okay, in that hospital, in that place, in that country, how many cases of stillbirths are there? Okay, this is called stillbirth rate, and it is always calculated for 1000 total birth. So sometimes when, for example, after you become a doctor or after you have completed your MBBS and you want to appear for licensing exam, okay, or any other type of exam, this type of questions may be asked to you. So you need to collect those data of your respective country. What is the neonatal mortality rate? What is the maternal mortality rate? What is the perinatal mortality rate? What is the stillbirth rate? The government must have done all these studies in the respective country. So okay, so this is a sincere advice to you. Please, before appearing for any exam, so these are the data you need to collect and memorize. Now let's move on. Another important term is perinatal mortality rate. This term will come in pediatrics also, so I'll again mention it there. Now, perinatal mortality rate means the annual number of stillbirth and neonatal death in first 7 days after birth. Now, some books mention till 28 days after birth as well per 1000 total birth. Now, let me utilize a time and explain it in a nice way. Okay, now see here. The perinatal mortality rate, you first need to know what is the perinatal period. Then if you know that perinatal period, then the understanding of perinatal mortality rate would be very easy. The perinatal period starts from the period of viability. Okay, the period of viability, that is after 20 week. That's the first thing. Till what? Now, different textbook mention it differently. Okay, so many of the textbook mention it till first 7 days after birth. From 20 days, 20 weeks of gestation, okay, till first 7 day after birth. This is called perinatal period. But some other textbook mention till 28 days of birth. So it doesn't matter. Okay, it doesn't matter whatever you answer. Okay, because different textbook mention it differently. So both are the correct one. But I urge you to remember the first one. That is, from 20 weeks of gestation till first 7 days after birth is a perinatal period. So if a baby die during that time, this is called perinatal mortality. And if we calculate the rate per 1000 total birth, we call it perinatal mortality rate. It is now easy for you to understand. Now, what are the causes of perinatal mortality rate? The most commonly, it is caused by prematurity and congenital anomaly. Now, prematurity means when the baby is delivered before 37 week. Means that is a very premature baby. It is not well formed baby. You can understand like that. So of course, there is a chance of a lot of complication. And congenital anomaly, some congenital anomalies are very lethal. Okay, they are a serious type of anomaly, and those baby cannot survive if they are present. So these are two commonest causes of perinatal mortality. Now, okay, all students, please, okay, have a look at this. Okay, go through this. Okay, I'll give you a few minutes time. Please go through this and let me explain one by one. Okay, now see here, please. Okay, now listen carefully. So gravidity, we already define it. The total number of pregnancy irrespective of the pregnancy duration. I already told you, after it is confirmed that the lady is pregnant, gravida is considered. If urine HCG test is positive, it is considered she is a gravid lady, means she is pregnant. Okay? Nulli gravida, woman who is not currently pregnant and has never been pregnant. Nulli means nil. Nulli means zero. She has never become pregnant. Okay. So sometimes what happens, the lady considers or thinks she's pregnant, but the pregnancy test becomes negative. Okay. This is nulli gravida. Primi is first time. Primi is the first time. So primi gravida, the woman who is pregnant for the first time is called primi gravida. It's quite easy definition. Multi means multiple times, many times. Woman who is pregnant currently for more than the first time, means she already been pregnant before. Maybe she has some living babies at home, or maybe, okay, the termination of pregnancy has happened before as abortion. So all of these are called a part of multigravida. Parity, this also very clear to you now. The total number of pregnancy achieving more than 20 weeks gestation. Any pregnancy which cross 20 weeks is parity. Any. We don't, have to know whether that baby is still surviving or not, because stillbirth is also a part of parity. So this is a very important point. But remember, abortion is not a part of parity, because abortion has not crossed 20 weeks of gestation. Now, similarly, nullipara. Nulli means nil. Woman who has never carried a pregnancy more than 20 weeks gestation. So nullipara. Quite easy understanding. Primipara. First time. Prime is first. So woman who has carried one pregnancy achieving more than 20 weeks gestation is primipara. Multipara is multiple times she has carried pregnancy to more than 20 weeks gestation. Multipara. And there are some new terms for you like parturient. Parturient means woman who is in labor. Okay, so she has already developed the signs of labor. She is going to give birth to a baby. So she is called a parturient lady. Not very commonly used term, but purpura is a very commonly used term. Purpura means woman who has just given birth. Now, listen carefully. This purpuric period is considered till 6 weeks after gestation. Okay, till 6 weeks after gestation. 6 weeks after birth, I should say. Okay, she has given birth in a hospital or at home. till 6 weeks after birth, this is called purpuric period, or the lady is called a purpura. Now, similarly, we have to remember this definition before we move further. These are not very difficult one, but probably in the beginning it is a bit confusing for you, okay? But if you revise more than once, these are catchy for you. So please have a look there. Okay, so let me explain for you. Abortion, many students know it now. Pregnancy loss prior to 20 menstrual week, or it is also known as 20 gestational week. That is abortion. A better definition would be discontinuation of pregnancy before 20 gestational week is called abortion. It can be spontaneous, it can be induced. Now, antepartum death. Now, antepartum. Now, remember one important point here. Partum is labor. Okay, partum is labor or delivery. Ante is before. So, if a baby is dead before the labor or delivery, okay, means if the baby dies inside the uterus, okay, after 20 menstrual week, but before the onset of labor, this is called antepartum death. So fetal death between 20 menstrual week and onset of labor is called antepartum death. This is one of the very, very common cause of stillbirth. Now intrapartum. Now listen it very carefully. Partum is delivery or labor. Intra means during that time. So once a lady has already developed labor pain, we have taken her to the hospital, and because of prolonged labor, because of some complication during the labor, if the baby is dead, we call that intrapartum death. So this is fetal death from onset of labor till the birth. Fetal death, on the other hand, is between 20 menstrual week and the birth. Okay, so this is fetus. It's another term for stillbirth. Actually, you can easily call it stillbirth or fetal death. Both are considered same term, but stillbirth is used much more common than fetal death. Perinatal death, so many times I already explained to you. Fetal or neonatal death from 20 menstrual week till 7 days after birth, which is highlighted in many textbooks, or some textbook even mention 28 days after birth. Okay, so both are considered. Neonatal death, neonatal period means first 28 days of life, or after the baby is born till the first month or first 28 days is called neonatal period. So newborn death between birth and the first 28 days of life is the neonatal death. Infant means till 1 year of age. Okay, till the first year of life is infant. So if a baby is dead there, it is called infant death. And maternal death is, this is a considered very, very serious thing. A woman who died during pregnancy or within 90 days after giving birth is called maternal death. And if a country has more number of maternal death, that the health status of that country is considered very, very poor. Okay, so these are some of the important definitions. Now, okay, this table clearly tells us about some more definition. Okay, and it takes a bit of time for you to understand this, but let me tell the importance of this. When you appear any future exam, these are the important data based questions which may be asked there. Okay, so what is the birth rate? So look at the definition. Number of live birth per 1000 total population is called birth rate. Number of live birth per 1000 total population. Fertility rate. The fertility is all about, okay, chances, isn't it? Chances of having a living, birth or live birth. So number of live birth per 1000 women who are aged 15 to 45 years is called fertility rate, because this is a fertility period in a lady's life. So if they ask you what is a reproductive period or fertility period, this is from 15 to 45. Okay, because we roughly believe, okay, this is between the period of menarche and menopause, though this doesn't exactly fit, because many of the girls, they start menarche at the age of 12 or 13 or sometimes even before than that. Okay, but let's talk about average one, and let's make it easier. That's why it's 15 to 45 years. Fetal mortality rate is the number of fetal death for per 1000 total birth. Okay, now what is fetus? Anyone can tell me what is fetus?
Three, three.
The fetus is a developing embryo.
Yes, Irfan.
Embryo
Yeah, one by one, please. Yeah.
before 2 months.
Okay, so let me tell the definitions, because this is the first glance. Probably many of the students are confused. Okay, many of them already know. I know that. Now, fetus means whenever a baby is developing inside the uterus before the birth, we call that fetus. Okay, now that fetus should cross, okay, 8 week of gestation, because before that time we call that embryo. Okay, so that is a bit of different thing. But if somebody asks you this, what is fetus, then you can say the baby who is developing inside the uterus is called fetus. That is considered absolutely fine definition. So number of fetal death per 1000 total birth is fetal mortality rate. Just like that, neonatal mortality rate is number of neonatal death per 1000 live birth. Now again, neonate means first 28 days after birth, or first month after birth, or first month of life, I can say, is the neonate. Perinatal mortality rate, you already have studied. Number of fetal and neonatal death per 1000 total birth is a perinatal mortality rate. Now see that the fetus is included here because the perinatal period starts from 20 weeks of gestation. That's why fetus is included, and neonate. Now according to the different book, I want to revise that again. First 7 days after birth is more accepted definition, but some other textbook also mention till 28 days after birth. So both are considered fine. Infant. Now infant is till 1 year of age. So number of infant death per 1000 live birth is called infant mortality rate. And maternal mortality rate is number of maternal death per 100,000 live birth. This is maternal mortality rate. So these are some of the important definition. And let me clarify once again, or let me tell the importance of this once again. These are not very importantly asked in your university exam. Okay, we don't bother to ask about these things. But when you are about to appear in your future board exam or in any other similar type of exam, these are very, very important questions. Now, before we go into the second topic for today, look at this slide once. See here, it will clearly tell you all the concept, whatever we are talking till now. Okay, so let me explain this nicely. See here, this is the time of conception. Time of conception means time of fertilization. Okay, so it usually occur during the second week, okay, of that menstrual period. What happens after that? This is a period of pregnancy. See here, 40 weeks. Now 40 weeks is the average duration of pregnancy. Okay, so you can say this 0 is the last menstrual period, or LMP, last menstrual period, or LMP. Okay, now fertilization occurs near about in the 2nd week, and after that, okay, implantation occurs. Okay, 1st trimester, 2nd trimester, 3rd trimester occurs, and everything occurs till it reaches 40 weeks of gestation. And we believe near about this time the delivery or the birth occurs. Sometimes the birth occurs much before that, sometimes even after that. Okay, but this is the normal thing we are talking right now. If a baby is born, or we can say if a pregnancy is discontinued before 20 weeks, because before 20 weeks actually the baby is not well formed. So rather than use the term baby, if you say if the pregnancy is discontinued before 20 weeks, it is called abortion. So very nicely shown here. Okay, see here, before 20 weeks. Okay, if there is discontinuation of pregnancy, okay, it is abortion. Now, after that, these terms are used: perinatal death or fetal death. Now perinatal death from 20 weeks of gestation, okay, till 7 days after birth, or till 1 month of age. Okay, so both are considered a part of perinatal death. Fetal death after 20 weeks of gestation till the birth of the baby. If the baby is born dead, this is called fetal death, also known as stillbirth. Fetal death is also known as stillbirth. The baby is born normally, but within 1st month of life the baby died. This is called neonatal death, because that is called neonatal period. First 28 days of life is called neonatal period. So if a baby died during that time, we call it neonatal death. Now infant is till 1 year of age. Okay, till 1 year of age. Then if a baby died during that time, we call this infantile death or infant death. So these are some of the important points for you.